Okay, I welcome you, and we are going to start our class. Still waiting for some students to come. We are going to discuss about determinants of the health. We are going to discuss determinant of the health. We have discussed in last class about malaria, that was about disease, but I think you may be remembering. Very good morning to all of you. I am getting live chat. Good morning. Very good morning to all of you. My voice, hope so that my voice is clear. My audio is also clear. And I think in physical class, you may be remembering that we had started with the general epidemiology, and in which we have discussed about agent, host, and perhaps environment also. So we are continuing with it general epidemiology. In that, we are going to see about determinant of the health. And please write down that whether my voice is clear or not. Please write down whether my voice and my audio is clear or not. My video and my voice, both of them are clear or not. Please write down in chat box. So in determinants of the health means our health is determined by so many factors. Our health is determined by so many factors. First of all, you can write down in chat box what is definition of the health. We have discussed in our previous class also what is definition of the health. What do you mean by health? Please write down in chat box what do you mean by health. Then we are going to see what are the determinants. What are the determinants of the health that we are going to see. First, write down what is definition of health. What WHO has defined health in a simple language that we have discussed in previous class also in our physical class. So, what is definition of health? I am waiting for your reply. Definition of health. What is definition of health? I am waiting for your reply. Yes, Darshal is replying, state of being free from illness or injury. Then free from illness. Actually, that is your perception of the health, not definition. Yes, Isita is replying, it is a state of physical, mental, social well-being. Very good. Okay. It is a state of physical, mental, social well-being. Then, any other reply? Physical, social, mental well-being. Tanvi is replying. Any other thing? Physical, social, mental well-being. Apart from this, okay, so we are going to see determinant of the health. As I have discussed, as I have asked, that definition of the health is, it is given by WHO. It is a state of complete physical, mental, and social well-being. Complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. So remember this definition well, because it is the heart of community medicine. Remember this as a tip of tongue. Health is a state of complete physical, mental, and social well-being, and not merely an absence of disease. Means only absence of disease doesn't mean that patient is healthy. There may not be any physical disease, there may not be any injury, but mentally there will be diseased condition. Like in case of today's scenario, in lockdown, and in absence of other work, person may become anxious, person may be experiencing depression. So that is also ill health condition. That is not health. Socially ill healthy, socially in relationship failure. That is the best example. Socially in family there may be unhealthy condition. Social relationship are unhealthy. So that is also not health. So health should include all these things: physical dimension, mental dimension, and social dimension. So health is multifactorial. It is multifactorial. Okay, just let me on the pointer option. And meanwhile, you remember this. Try to remember the definition. And try to remember the definition of health. Okay, so health is multifactorial. It is multifactorial. Many factors determine the health. There are so many factors which determine our health. It is not our ourself only that determine the health. What are the factors? Write down in chat box. What are the factors that determine the health? Our health is dependent on which factors? Write down in chat box. What are the factors that determine the health? What are the factors? Okay, still 45 students are online. Please message to your colleague that your presence is necessary. I have the system of making attendance over here also. Apart from this system, I have dual system of marking your attendance. So we are sending regularly your attendance. Okay, so I'm getting reply. Immunity, Darsali says, Kurti says food, meditation, exercise, yes. So ask to your colleague to join our session. It has started. It is very interesting. We are sending regularly your attendance. And I will be sending you Google assignment form, not assessment form, based on this topic also. So I'm getting reply. Everybody says social and economic environment, lifestyle, Apexa says, then Ganatra says, a part of development. How part of development? So we are going to say that, see the determinant. So there are various factors. There are various factors that determine the health. Some of the factors are biological factor broadly. These classes are broadly biological factor, environmental factor. Remember this. These are again broad headings. We are going to see in detail also about this heading. Then lifestyle, socioeconomic condition, health services, aging of the population, gender, and so many other biological factors like presence of vectors or absence of vector, environment like cold condition, heat condition, lifestyle like having exercise or not having exercise, like taking healthy diet and taking unhealthy diet. Then socioeconomic factor means poverty, middle socioeconomic class, higher socioeconomic class. So according to socioeconomic conditions, the disease may vary, right? Health service. We are going to, of course, discuss this in detail. Aging of the population, then gender. Okay, aging of the population. Say, for example, in India, age of the population is young, means more than 65% of the Indian are young population. And in case of the Italy, the more than 65 years, more than 60 years populations uh, are more in number or more percentage in number. Here it is 6.5%. More than 65 years is 6.5%. In case of the Italy, it is more than 20%. So death in case of the corona are more in Italy as compared to India. Then gender. So some diseases are common in male, some diseases are common in female. So we are going to see one by one. So first of all, biological determinant. So biological means it is genetic, inheritatory. Biological means based on our body, based on our genes. So it is the physical and mental trait of every human being depending upon genetic makeup of the individual. So some genetic diseases are there which are determining our health. So it is unique. Genetic makeup is unique, that it cannot be altered after conception. We can alter this environmental factors to some extent. We can alter our lifestyle, but this genetic factor or biological factors or biological determinant, they cannot be altered. So main part of the DNA is gene, as you know, you have studied in your higher secondary class also. If there is a defect at the gene level, then it will lead to disease. For example, you may be remembering some of the genetic disease. For example, this Down syndrome, Turner syndrome. Down syndrome is trisomy 21. Then Turner syndrome is X0. Klinefelter syndrome is XXY. Some errors of metabolism like copper metabolism. Then some types of the diabetes also are hereditary, particularly type 1 diabetes. So these factors, they cannot be altered. They cannot be altered once there is conception. But there is also preventive measures that to prevent this type of the disease, screening during pregnancy, or sometimes in some cases screening before marriage also. Like for example, you know that about thalassemia, screening of the thalassemia for both the I mean to say couple. So if both are having thalassemia minor, they cannot marry. But even if they marry, there are also screening methods during pregnancy also that will lead to chorioamniotic sampling. And from this chorioamniotic sampling, we can easily diagnose this of the genetic defect, and abortion can be planned. So in positive terms, genetic point of view, health may be defined as genetic point of view. This is the definition of the health. No need to remember this definition. Just you observe this. Only you have to remember the definition of the health given by WHO as we have discussed in starting. So presence of genetic constitution of the genes that correspond to the normal characterization and presence of normal karyotype. Normal characterization. Karyotype you already know. So normal karyotype is normal health. So that was about biological determinant. Now environmental determinant. We are often hearing in case of the corona that heat will kill this coronavirus. So high temperature will kill this coronavirus. So that is the best example of this environmental determinant. So it was Hippocrates first related this disease to environment. Pettenkofer is the scientist in Germany revived the concept of the disease environment association. And as you know that we have also discussed about epidemiological triad. In this triad, agent, host, and environment. Third factor is environment. So environment is vast factor. Apart from the temperature, there are so many other factors like housing, like environment of our house. If our house is polluted, if our house is there in unhealthy condition, if we do not sweep our house daily, then housing may lead to also some of the disease. If our house is congested, if our house area is overcrowding, in our house there is overcrowding, if it is located in near to the industrial area, if it is located in unhygienic condition, then we may get chance of this infectious disease. So housing, like you know that in house there are kacha house, there are semi-pakka house, there are pakka house. So in kacha house there are chances of infectious disease more. Even in pakka house, because of the presence of this humidity, as well as you may have observed that in some of the walls there is water. So that because of that there may be chances of fungal transmission. So housing, then water supply. What is the source of your water supply? That also determines your health. That is also determining your health. So in case of the water supply, if it is from municipal area, then the hardness of the water will be less. In case of the water which is from the deep from the ground, so here there will be more hardness. So your water determines your health to a large extent. It determines your health to a large extent. So if it is polluted, you may easily get the chance of the waterborne disease like cholera, typhoid, poliomyelitis. If it is hard, then you may also get chance of kidney disease, stone, etc. Then psychological stress, it also comes in environment. Psychological stress, it also comes in environment because whatever in environment we live, there may be also some stress because of the other people, some stress because of the environmental condition. For example, heat may also lead to psychosocial stress. Presence of other people which we do not like, they may also lead to psychosocial stress. Interaction with the other people which we do not like, that may also lead to psychosocial stress, and it may lead to this unhealthy condition. So it is the environment has the direct impact on the health of the individual. Environment is one of the major determinant of the health. Protection and promotion of the family and environmental health is one of the major issue in world today. You know that environmental health, protection of the family from environment, ill-healthy environment. You may be hearing that during this lockdown period, our environment has become clean, our air has become clean, our water has become clean, Ganga has become clean, right? You may be hearing or you may be watching such type of the video. So before lockdown, during winter season, you have also heard that in Delhi, the air is much more polluted during winter season, and there is lot of fog in Delhi during winter season. So living in this foggy condition, it becomes very difficult. So environmental protection of this environmental health is one of the major issue in world today. So we have discussed about biological factor, environmental factor, now about lifestyle. So you may be hearing about lifestyle diseases. Tell me, what are the lifestyle diseases? Yes, write down in chat box. What are the lifestyle diseases? What are the lifestyle diseases? Now you may be watching the PowerPoint clearly. I have got some of the students feedback that PowerPoint is not clear. Kruti, now is it clear? Now this PowerPoint is clear. Is that clear? And write down that what are the lifestyle diseases? What are the lifestyle diseases? 62 students are there. Still so many students are sleeping, I think. Okay, now PowerPoint is clear. Yes, lifestyle disease. Ethel is replying diabetes. So wake up your colleague. Wake up your colleague. Even if they have not brushed, even if they have not bathed, they can directly join from their mobile. I don't mind. Obesity. Dhiral is replying. Obesity. Tanvi has replied. So these are the lifestyle diseases. Okay. So lifestyle. Having exercise or not exercise, having healthy diet or unhealthy diet, these are the best example of lifestyle. Then working environment, where do we work? That is also our lifestyle. That also affects our lifestyle. So lifestyle, the way people live has also an important role to play in health of the individual. It reflects social values, attitude, activity. Whether our attitude it is positive or negative, it also determines our health. Somebody is having always a negative attitude, so negative attitude will lead to this negative type of the behavior, and it will lead to psychosocial condition, social value. Then activities. If we do positive activities during this lockdown, if we are engaged with the positive activities, that will lead to some new development. If, for example, we are learning this online class, we have learned WebEx, we have learned this YouTube online. So this is the positive activities that we are doing, and it will be leading to having the positive impact on our lifestyle. Right? Habit on smoking, most important factor, smoking. Alcohol. So smoking, tobacco chewing, particularly in Gujarat, particularly in Saurashtra, tobacco chewing. Without this tobacco, without this easy availability of the smoking devices, cigarette, etc. Without this alcohol, so many people are experiencing anxiety nowadays. I have heard also that because of alcohol withdrawal, so many people are experiencing ill health because of alcohol withdrawal. So that reflect on the health of the person. So that is also included in lifestyle, smoking, alcohol. So smoking, because of the smoking, there are the diseases like COPD, that is chronic obstructive pulmonary disease. There are the most common condition, lung cancer. Smoking can lead to lung cancer. It has been observed in many studies that those people who smoke and those people who do not smoke. So among those who smoke, there is always higher chance of lung cancer and COPD. So there are two types of smoker: active smoker and passive smoker. Active smokers are those who are smoking. Passive smokers that do not smoke, but they may experience the smoke of the active smoker. Suppose in our presence there are some person who is smoking, then because of the smoke of that person, we may be experiencing this passive smoke, and repeated exposure to such passive smoke. If we have our friends who are active smoker and we are not smoking, we are every day meeting with that friend, and we are experiencing every day passive smoking, that we may also have the chance of getting this COPD or lung cancer. So eliminate that kind of the friends who are active smoker, to whom we have to meet regularly. Alcoholism. So alcohol, you know about that. Alcohol is also a risk factor, potential risk factor. It may lead to gastritis, hepatitis, cirrhosis. And these are the GIT diseases we have discussed: Wernicke's encephalopathy, coroscopsychosis, okay, Mallory-Weiss tear, myopathy. So remember simple names that you can easily remember, and most common, this alcoholic liver disease, alcoholic hepatitis, gastritis, cirrhosis, that you can easily remember. So many current problem, day-to-day problem like coronary heart disease, obesity, lung cancer, they are always associated with the lifestyle changes. So in developing country, because of the in developing country like us, lack of sanitation, poor nutrition, lack of personal hygiene, customs, and culture pattern are the major risk of the illness. Sanitation drive, you must be aware of the sanitation drive started in 2014. So that sanitation has improved to a great extent because of this sanitation drive. So in country like India, we cannot easily advise people, that we cannot easily instruct patient. We have to come with any drive. We have to come with the program. We have to come anything which we want to change in form of the campaign. We have to link this part with the religion. So religiously it should be followed. So it is followed in people of India religiously. Poor nutrition in India, in particular in Gujarat, about 45% children are malnourished, and among them 12% children are severely malnourished. So because of the poor nutrition, poor development, and there are always chance of getting this nutrition related disorder. You may be knowing that protein energy malnutrition, PEM, kwashiorkor and marasmus, lack of personal hygiene. Sanitation is environmental sanitation. This is personal hygiene, like not washing hand frequently, not washing our face, not bathing. This is lack of personal hygiene. In case of female, lack of menstrual hygiene. That is also included as a part of lack of personal hygiene. You have recently, I was watching that Padman. You may be aware of that movie Padman. So here also value of personal hygiene, menstrual hygiene, and that is an integral part of the personal hygiene. It has been shown. Some of the custom, cultural pattern, and that are also respected for the illness. Health require promotion of the healthy lifestyle. So environmental condition, again, it has been divided in two parts: internal and external. First of all, external. External environment is physical environment, like heat, like cold, like humidity, like rain. That is external environment. Then biological environment. So in the area in which we live, whatever the biological substances are there, these are also part of the environment, like trees. As we know that lack of the tree, like tree cutting will lead to, again, environmental ill health. So as you know that in many cities, plantation movement is going on. Like in case of the Rajkot city, that Sadbhavana Old Age Home, it is carrying out the plantation campaign. There is a number that if you call that number, the team of the Sadbhavana will come to your house and they will plant a tree. There is also a long list, waiting list. In Rajkot city, you may be seeing that in divider in around the road also plantation has been done by Sadbhavana Old Age Home. So that is biological. Then biological include one of the example, that is tree. Then in the environment which we live, other biological system like other animals. Suppose there are so many dogs in our street or in our city, then there may be chances of the dog bite and getting rabies. If there is a mice or rat living in our house, so there may be chances of the rat-borne disease, mice-borne disease. So these are example of biological. Then insect also come in a biological environment. This mosquito also comes in biological environment. Presence of a mosquito may lead to mosquito-borne disease. So these are the vectors which are also there in biological environment. Then psychosocial environment. So environment is also including psychosocial environment, which we have discussed previously. Then internal environment. Internal environment is environment inside our body. So tissues, organ system. If there is no harmony, if there is failure of any organ, if there is failure of organ, suppose kidney, then it may lead to disturbance in our internal environment. For example, failure of the kidney will lead to increased level of serum creatinine, serum urea, blood urea. So that is disturbance in our biological environment. Socio-economic condition, it includes economic status. For example, in low economic status, there are the conditions, there are the disease like malnutrition. And because of the low economic condition, person may not be able to buy food for his or her family. So you may be seeing that during this lockdown period, even in APL 1 card, ration card, government is distributing some that wheat and rice and everything, that cereals and pulses. So economic status, again, it will determine, it will lead to poor housing condition, poor economic status, poor housing condition, and it may lead to some infectious disease also. In higher economic status, there are lifestyle related diseases. In high economic status, particularly this diabetes, hypertension, and this obesity, these diseases are common. Education, most important determinant, even more than this economic status. If any person is well educated, then person's understanding about disease will be better, person's understanding about health will be better, person's understanding about wrong custom, wrong culture, it will be better. Best example in India is Kerala, as you may know, as you may be knowing that more than 99% in Kerala are limitation. Only literacy is able to read and write, but education is to understand. Education brings understanding. So in Kerala, you may be watching that in our tracker that Kerala has started Corona before any other state, and now Kerala is going downwards in number of the corona cases. So they are decreasing corona cases day by day. They are preventing an increase of the number of the corona cases, and recovery cases, number of the recovered cases are increasing day by day. So they have controlled because they are educated. So all the indicators apart from this corona, all the indicators in corona are better than any other state of the India, like infant mortality rate, right, maternal mortality rate. All these indicators are better in Kerala because of the education. If in case of education also, education of mother, education of the women of the country is most important. Education of the mother of the country or women of the country is most important, because mother is the primary healthcare provider. Mother is primary healthcare provider of the country, primary healthcare provider of the family. If there is any ill health condition in family, then mother will be the first healthcare provider. So if mother is well educated, she will provide good health to their children, good health to their to family. So that is education. Then talking about occupation, occupation is also one of the important determinant. So there are so many occupational diseases, as you know, like pneumoconiosis. If any person is working in coal mine, there may be coal worker pneumoconiosis. In case of working in this cotton industry, there may be bicinosis. There may be bagasosis if a person is working in industry with sugarcane. Then in industry like chemicals, industry working in chemical like exposure to benzene, it may lead to leukemia and other cancer. Even teachers may have a singer's nodule or this musician nodule that is swelling in the tonsil. Then political system, like in case of our country, our political system is very strong. So determinants of the political system, it is also willingness of the political system to give the help to the people. It is also one of the important determinant. If prime minister or chief minister is not willing, he is not keen about providing health to the people, then the health of the country will not be good. So in case of the India, best example is that our system, our government is very keen to provide good health. You may be watching this since corona has started. They are very keen to prevent corona cases. Day-to-day monitoring, day-to-day supervision is being done, and not only in corona but also in other cases also. In case of the other condition, in case of the maternal and child health condition also, our political willingness is very strong. Then economic status, per capita GNP is the most widely gross national product. GNP is gross national product, so it is accepted measure of the economic status. So economic status, if the per capita GNP, I give you the example, per capita income earning, in simple term, we are not economists, we are the coming from the medical background. So in simple term, per capita GNP is per capita income. If per capita income is more, then purchasing power will be more, standard of living will be more, quality of the life will be more, and there may be also deviant behavior in community. Life expectancy is also determined by this per capita or economic status. So as we know that per capita income is more in case of the developed country like US or your UK or Germany or France. So they are having more purchasing power, more good standard of living, good quality of their life. Okay, but simultaneously there is deviant behavior in this community. Okay, in Japan, life expectancy is highest. Okay, education, I have already told about education, already discussed about education, how it impact the health of the person. Illiteracy can be the major cause of the poverty, malnutrition, ill health, high infant and child mortality. So in community, in many community there is illiteracy. Because of the illiteracy their behavior is like that. Because of the illiteracy there is poverty, there is malnutrition, ill health, high infant and child mortality rate. Female literacy has very important role to play, as I have already discussed. Education, Kerala, I have given the example, infant mortality rate of 14% as compared to 71% of all India in 1999. So occupation, I have also given the example like pneumoconiosis, in which one of the example is silicosis. So the workers who are working along with silica dust in many factories, silicosis, coal worker pneumoconiosis, asbestosis, coming into contact with the asbestos, bicyanosis, coming into contact with the cotton. Political system, I already determined this main obstacle in the implementation. Nowadays it is not obstacle. So decision concerning to the resource allocation, manpower policy, choice of technology, all this is dependent on the political system. Suppose resource allocation, suppose in Ahmedabad there are more cases of the corona, so we have to allocate more manpower, more resources to the Ahmedabad. So many doctors from Jamnagar as well as other district have been they have been deputed to the Ahmedabad. So that is resource allocation. That is determined by political system. Then manpower policy, how many doctors to recruit. So that is also dependent on the political system. Choice of technology. So degree to which health services can be made available are decided by political system of the community, and advantage of GNP spent on the health. So one of the most important indicator that how much of your GDP, not GNP, but how much of your GDP is spent on the health. WHO recommends that at least 5% of your GDP, that is gross domestic product, should be spent on the health. But India is spending around 2%, around 2%. If poor health pattern are to be changed, entire socioeconomic system is to be changed. Then another factor is health services. Okay, till now which factors we have discussed? Write down in chat box. I am waiting for your reply. Till now, which factors, which determinants we have discussed about? Till now, which determinants we have discussed? Determinants of the health. I am finding that 65 students are online, so there is also absence of around 27%, 30%. Okay, so I will be informing to your class coordinator that only 65 students are there online. Okay, which determinants till now we have discussed? Write down in chat box. Which determinants we have discussed? We have started discussing about determinants of the health. So write down in chat box which determinants we have discussed till now. I am waiting for your reply. Yes, I am getting reply. Political, biological, environmental, education, occupation, biological, occupation, education. Okay. Internal and external environment, environmental, biological, socioeconomic, lifestyle, education, occupation, environmental, occupation, biological factor, environmental factor, political, education, lifestyle. Yes, very nice. I've got reply from many students: Sunil, Parth, Ajay Singh, Milan Vora, Chaya, Jani Nidau, Divyesh, then Rutvi, Ishita, Priyanka, Surani, Tanvi, Ajay Singh. So I've got reply from so many students. I may miss some of the names because chat box is full. Disha, okay, Sunil. So still there is some time. Ask your colleague to join if they have not joined. At least their attendance can be marked. We will be marking attendance for full, actually for full presence, not for some appearance. And that is also, there is also system to mark like that. For how many duration, for how much duration you have attended this session, that is also available in this system. And duration is also available. Okay, so we are moving forward. Police legal system we have done already. Health services now. So availability of the health services, that is also one of the major determinant of the health. Suppose health services, if it is available in your nearby area, then the person will be easily getting health, easily seeking for the treatment. Availability of the primary health services like immunization, like maternal and child health services. So in whichever area this health services are available, people may easily seek health. So non-availability of the health services may lead to worsening of the disease. Like in case of the hilly area, if there is no availability of the health services, then people may die because of the absence of these health services. Infant mortality rate, maternal mortality, all the indicators are poor in case of the area services. So immunization, it influences incidence and prevalence of the disease. More immunization, like in case of the India, immunization coverage has increased since last 10 years. So the vaccine preventable disease are decreasing. You may be aware that polio has been eliminated. There is also measles elimination at the verge, or rubella has been controlled. So the vaccine preventable disease all are controlled because of the immunization. That is the example of the availability of the health services. You know that the door-to-door immunization in case of the polio vaccine has been done. Safe water, availability of the safe water will prevent waterborne disease. So to be effective, the health services must reach the periphery. It should be available in all the villages, in periphery, in sub-center area. You know that in periphery, to reach the health services, health and wellness center has been established. And there is also post of this community health officer, FHW, in sub-center in health and wellness center. Equitable distribution. So regardless of the socio-economic class, regardless of being residing in city or regardless of being residing in villages, equitable distribution. So equally it should be distributed regardless of the class. So in government services, higher class people are also going, as well as middle class, lower class. So regardless of the class, services are available. It should be cheaper in cost. So in government health services, it is free of cost. All the immunization, for example, immunization services, which if any child is getting immunized from birth to 5 years, then in private it may be costing around 15,000, 20,000, which is available at free of cost in government health services, and better quality also. So, and it should be socially acceptable also. So primary health care, as you know, that primary health care, aging of the population. I have already discussed that rapid population aging is increasing the prevalence of the chronic disease and disability. If age of any country, population of the aging of the population of any country is more, then chronic disease like diabetes, hypertension, like obesity, like this, any of the chronic arthritis. So this disease will be more prevalent in that disease than that area. And I already discussed this example. Gender. So in gender, some of the diseases are common in male, like hemophilia, like myocardial infarction. This is common in female, are thyrotoxicosis, rheumatoid mitral stenosis. So gender also affects or determine the health. So female health is very great important, because female health, that's going to determine the health of the child. Always the importance to female has been given. Female is always first. right? So likewise here also, health of the female is very important, because female is going to give birth to the child. So if there is healthy female, healthy mother, then at the end of the pregnancy there will be healthy mother and healthy baby. It covers health of the female, covers nutrition, reproductive health. So during pregnancy as well as before pregnancy, it has been much stress upon the nutrition and reproductive health also. So as you, for example, between 15 to 45 years of the female, all female have to take iron supplementation weekly. Other factor like science and technology, if there is more development of the technology, then it will give rise to the good health condition. For example, in case of the corona, so many industries are making this ventilator. For example, in Rajkot city, ventilator has been produced. So improved technology, that CNC industry is there. Now they are not used to produce this ventilator. So they have developed the technology to produce the ventilator, and it is helpful to the our country as well as other country also. More revolution in science will lead to development of the more vaccines. For example, we are searching for corona vaccine since many months. Information and communication, good information and communication. For example, what we are learning now through this online class, so that is development of the information and communication, if any. So we are discussing about the health through online. So the more developed information and communication will lead to the development of the people in terms of the health. Food and agriculture. So if any country is having good system of the production of the food, good agriculture system, the nutrition system, nutrition will be good. Industry, then social welfare, like in case of the corona, so many social welfare activities are going on. So social welfare is also providing health to the people. Suppose if any person is residing in Rajkot, it is sure that he will not die because of the poor nutrition. In such so many social welfare that agencies are distributing tiffin every day. For example, Sadbhavana Old Age Home is distributing around 5,000 tiffin every day. So when a person is residing over here, their nutrition will not be impaired. Adoption of the policy in economic and social field. So these are all determinants of the health. So again, to summarize, biological determinant, environmental determinant, socio-economic, education, health services, these are all determinant. So we have still time. We will be starting with another topic. So don't go anywhere. Stay online. We have some time of around 10 minutes. So we will discuss for 10 minutes about other topic also. So don't go away. Still be online. I am sharing that. We are going to discuss about indicators of the health. We have discussed determinant of the health. So determinants of the health are asked in your exam. Determinants of the health are asked in your exam as a short note. Determinants of the health are asked in your exam as a short note. So read this topic very well. And now we are going to discuss about indicators of the health. So remember, these two terminologies are different. These two terminologies, determinants and indicators, these both are different. Okay, determinants means what determine the health, and indicators means what indicate the health. You have heard this word indicator in our day-to-day life. Indicator is present in our vehicle. So if we want to turn towards one side, we indicate, we give the indicator. So here also it is indicator of the health. So how is our health? It is indicated by many other factors. How is our health? Suppose the best example I give you, that our weight. Any person may indicate your health by looking at you, like your looking at your body composition or looking at your weight. If your weight is in normal range, so your health is good. Okay. If your weight is above normal range, then it may be good in other ways, that if you are always, so you are having good nutrition, you are having the bad lifestyle. But so if you are underweight, then your health is I meant to say you are undernourished. So that is one of the example of indicator of the health. So we are going to discuss about that. And there are two types of the indicators in case of the health: mortality indicator and morbidity indicator. So we are going to see first of all mortality indicators. So health, again, definition of the health, as I have told you that WHO definition of the health will be often asked in your exam, in your viva. So please remember this WHO definition by heart, and it is again written over here. Let me change the ink color of the indicator. Yes, why I am not getting that highlighter ink color. I'm not getting that ink color. Just a second. Just a second. Meanwhile, you try to remember the definition of health. Okay. So it is always dynamic state, in never constant. Health is dynamic. Today, any person is healthy, he may become unhealthy tomorrow. He may become unhealthy tomorrow. So it is called as dynamic state. It is not never fixed state. So many patients will be coming to you saying that if they find diabetes, sir, yesterday it wasn't, or before 2 years it wasn't. How it can come to me? So it is not so that once the patient is diagnosed as having not disease, then always no disease condition will not persist. Okay. So according to WHO guideline, health program evaluation, they are defined as variable which help measure changes. So health and nutritional status, which cannot be measured by directly, are measured by this indicator. How to measure this nutritional status? Means our nutritional status is good or not. It can be measured by with the help of the weight. It can be measured with the help of the height, right? So these are the variables. Health indicators are what? They are the variables that measure changes. It provides us clues to tackle the different health problem of the efficiently. I'm not very comfortable with this pointer. Just let me change this ink color, but it is not being changed. I wonder why it is not being changed. It is changed, but it is not visible. Just give me 2 minutes, please. Ink color which is suitable for this, whether it is black or not. Yes, this is fine. So how should be our indicator? There are some characteristics of indicator. They should be valid, they should be reliable. Indicator should be valid, it should be reliable. See, we what we are discussing in WhatsApp, or we are discussing in other social media, some many of the information may not be valid, it may not be reliable. Now I'm taking another example. It not mean we don't believe blindly to any social media news. So here also in indicator, it should be valid, it should be reliable, and it should be sensitive. Means if there is change in this indicator, if there is change in the weight, if there is change in the nutritional status, weight should change. It should be specific. Suppose weight indicates weight for age, it indicates their growth. So it should be specific, right? It should be feasible. It should be easy to do. Weight is easy to do. It should be relevant also. So again, remember that this indicator should be valid, reliable, specific, feasible, and relevant. So remember one small that mnemonic, SMART indicator should be SMART. I'm writing over here SMART. You can also simultaneously write down, if you have any other access, you can write down in mobile also. So this mnemonic from SMART you can remember. SMART means sensitive. It is sensitive. It is also indicating specific. Aim, it is not aim is not written over here, but you can write down measurable. Indicator should be measurable. It should be appropriate. It should be appropriate. Sensitive, specific, measurable, appropriate. It should be reliable. It should be reliable. Okay, and or relevant also. From R, relevant also. T doesn't stand for anything over here, but you can remember this SMAR and other which are not included is valid as well as this feasible. So types of the health indicator: mortality indicator, mortality indicator, then morbidity indicator, there is disability rate, Nutrition status indicator, what we have discussed about weight, that is nutrition status indicator. Healthcare delivery system indicator, utilization rate, indicator of the health and mental health, then environmental indicator, socio-economic, health policy indicator, indicator of the quality of the life, and other indicator. I give you example of one of this indicator right now. Then we are going to see about other indicators in next class also. Suppose mortality indicator. So in this mortality indicator, infant mortality rate. Mortality indicator include infant mortality rate. Morbidity indicator means here the number of tuberculosis patient in country, that is morbidity indicator. Disability rate, percentage of people disabled because of osteoarthritis, that is disability rate. Nutrition status indicator, so percentage of malnourished children in India, nutrition status indicator. Healthcare delivery indicator, so number of doctors working in PHC in India, healthcare delivery indicator, or number of number of PHC in India, healthcare delivery indicator. Utilization indicator, utilization rate, number of patients attending daily in PHC, that is utilization, how much it is. Okay, now I think I am reconnected. I think I am connected, reconnected. I think reconnected. We will discuss for 4 to 5 minutes, then we will leave. I think I am reconnected. Okay, so first of all, mortality indicator. First indicator is true death rate, means it is defined as number of death per 1000 population per year in a given community. Number of deaths per 1000 population. Here in India, it is around 7. So per 1000 people, 7 people are dying in a year in community. So it is crude death rate. It is restricted because it is influenced by age and sex composition of the population. Suppose in any country, age of the people is higher, then crude death rate will be higher. Life expectancy. Second is life expectancy. So in any point of time, it is highly influenced by infant mortality rate, and life expectancy is birth at defined as the average number of the years that people will live by those born alive. Average number. Suppose any newborn is there, so how many years he or she will live, it will be indicated by life expectancy. Suppose in India it is around 72 years. So if newborn will live for 72 years, so in current age specific mortality rate. Are you all online or not? So this life expectancy. Then infant mortality rate. We have discussed about mortality indicator. First we have discussed crude death rate. Then this life expectancy. Then infant mortality rate. So that is the death under 1 year, death of any person under 1 year, less than 1 year death, divided by total number of the live birth into 1000. Into here it is into 1000. Into 1000. Okay. So that is rate per 1000. Number of death of infant divided by total number of the live birth into 1000. It is very simple formula. Among 1000 live birth, how many infants are dying? That is infant mortality rate. So now I think we will discuss next time. That is all for today. Okay, so that is all for today. And if you have any question, I am waiting for your reply or feedback for 1 minute, 1 to 2 minutes. If you have any question. Any feedback from your side? How was the session? Any feedback from your side? Okay, thank you, thank you. Any other feedback apart from thank you? I will be giving question based on our this class as well as previous classes also. Now it will include previous classes also. So attempt, okay, attend that question also. Based on this assignment also, your attendance will be counted. So there are so many ways to count your attendance. So multiple ways. So you have to attend lecture, you have to attend that assignment. So it will be based on current lecture as well as it will be based on previous lectures also. So attend that questionnaire also. Attend that assignment. It is very simple. By that way you will be learning. That is the way of learning. Okay, thank you very much. Thank you very much. We are ending this broadcast. See you. Be safe.